Hello, everyone, and welcome to Functional Fertility, the podcast designed to demystify your hormones, up-level your lifestyle, and supercharge your fertility potential. I'm your host, Dr. Kalea Wattles, and I'm excited to venture into the realm of male fertility today with our guest, Dr. Justin Houman. Dr. Houman is a urologist based in Beverly Hills, focusing on men's sexual, reproductive, and hormonal health. We know that male fertility is half the equation, so I'm really happy to have his expertise today. Welcome, Dr. Houman.
Thank you. Thank you so much for having me. I'm excited to do this.
Well, I have been looking forward to having you on the show for quite some time, and it's for selfish reasons. That reason is because my Instagram messages are loaded full of people who want to know more about varicocele specifically. That was not on my radar of something that people would be messaging me about. This isn't an area where I have a lot of expertise, so I was really excited to reach out. I know that this is something that you see in practice probably all the time.
Yeah. When it comes to the infertility aspect, varicoceles are a quite common cause of infertility, of male infertility. And luckily, I mean, it's a very correctable cause behind it, but it's more common than you think.
Yeah, I can tell from all of these messages. So for anyone who's listening and they maybe don't have a lot of background, will you just tell us briefly what a varicocele is?
Yeah, so think of a varicocele as varicose veins of your testicles. So the same varicose veins that we get on our calves and our lower legs, that same kind of thing happens with your testicles. And the reason why it has such an impact on fertility is because your testicles are relatively temperature sensitive. They're very temperature sensitive. And the male scrotum, it's kind of a thermostat. So when it gets pretty cold outside, but the scrotum it tightens up and it pulls the testicles closer to the body. So it heats them up. When it's very warm out, it kind of relaxes, takes the testicles away from the body. And that self-regulation is what keeps the testicles functioning within a very narrow temperature range. So one thing that varicoceles do is, because of the fact that you're getting this, so varicoceles are the blood flow is not draining back to the heart, so therefore it's pooling around the testicle, increasing their temperature. So increased testicular temperatures, you're having an impact not just on sperm production and sperm quality, but also on testosterone production. So we know it impacts all levels of testicular function, not just from sperm standpoint, but also from a hormonal and testosterone standpoint.
Mm-hmm. And you mentioned it's similar to varicosities in other areas of the body. So are there the same type of risk factors like standing for a long time and poor circulation through the area? Are these the types of things that are also increasing risk for varicocele?
Yes and no. I would say not so much from the standing portion. So really, varicose veins are the guys you see varicoceles more often is guys who really are taller and lankier. As you can imagine, the distance from the testicles back to the heart is a lot longer for these taller guys, especially the guys who have larger, longer upper bodies. So typically we see them in those types of guys, not all the time, but I'd say if you have to kind of come up with some kind of general sense of what the guy looks like, that's who they are. And there's not really much from a lifestyle standpoint that you're doing to cause these. The vein is internal, deep inside our abdomens. So it's not like there's a lifestyle or particular type of thing that we do that makes it worse.
Mm-hmm. So if a couple has been trying to conceive, I'm always encouraging them, obviously look at male fertility as well. That's a huge part of this picture. Should our dads-to-be see a urologist like yourself to rule out varicocele as a cause of male infertility?
Yeah. I mean, yes, I would say obviously, and the question is just when.
Right.
Yeah, typically I tell guys if you're having issues, 3-6 months of trying, if you're really trying during that time, and you haven't achieved your reproductive goals, then both partners should get evaluated, not just the male partner, but the female partner too. So, and the evaluation is relatively straightforward from a male side. It's assessing for a varicocele, blood work to see your hormones, making sure hormonally things look good, and then discussing a lot of the lifestyle factors that could potentially be impacting your fertility. So the earlier you get, there's no right time to get evaluated. I have guys who come in even before they want to conceive, just to make sure everything's okay. That's completely fine. But the longer you wait, the longer something could go misdiagnosed or undiagnosed and create more problems down the road.
Right. I would say one of the most common questions that I'm having in my inbox about varicocele is surgery the only option?
Yeah, it's a great question. So it's the only option for um, long term good outcomes. I would say, there's probably one guy in my career who was able to avoid surgery, and ultimately, I think he actually ended up getting the surgery. But really, if you're not getting surgery, all you're doing is you're basically having ice around your testicles all day, right? All day. I mean, this guy was driving. He had, I think, 10 ice packs in his igloo cooler that he put in his car every morning. He was driving around. He's a salesman, so he was driving from place to place. Every time in his car, he was putting a new ice pack on his testicles. And to that point about the temperatures, he was eliminating the testicular, he was lowering the testicular temperatures that could often be caused by a varicocele. So, yeah, so I mean, surgery is the best option, and it's relatively straightforward.
Yeah, I think the fear that I've heard or the apprehension around the surgery is that maybe there's some perception it's going to damage testicular tissue and then there'll be even worse fertility outcomes. Let's maybe do some myth busting. Is that even a thing that we need to worry about?
No, no. I mean, if you're gonna do these, obviously go to somebody who does these a lot, like anything else, right? Any type of surgery or anything that you're gonna do, you want to do go to somebody who's an expert in the field. It's a small incision, I don't know, maybe 2 to 3 centimeter incision right in your pubic hairline. So that you won't even see the incision down after it fully heals up. It's outpatient. Probably takes 30 to 45 minutes. And the recovery is relatively straightforward. I mean, you're walking that day, you're a little sore for a few days, but after a week or two, you're fully back to normal.
Yeah, really minimal
It's
recovery
minimal. I
time.
mean, look, surgery is surgery, and I get it. There's no such thing as a insignificant surgery. It does carry their inherent risks, but if you're going to somebody who knows what they're doing, um, it's not as bad as what a lot of guys perceive. I think what you're saying is I receive that comment a lot. Guys are always like, "Whoa," like, "Oh my God, it's a big deal," but they realize afterwards that it was a lot easier than they thought.
Right. I think there is a perception that you're going to like remove a huge portion of tissue or something like that. That's very drastic. And I've seen you post about microsurgical varicocele treatment. Is that the standard? You do that for everyone, or that's something that you have to determine if there's a good candidate?
So that's what I do. That's what I specialize in, the microsurgical approach. And the only reason I do that one is because it's the most effective in terms of long-term recurrence rates. The closer you are to the testicles, I mean, you could really get the vein at any point. If the testicles here, anywhere up to the where the vein enters the main blood circulation back to the heart. But the closer you are to the testicles, you're tying off those veins, really essentially at their origin. And by doing that, the recurrence rates are significantly lower. So if you're going to do it right. The microsurgical approach is probably the least painful. Not only is it the least painful, but probably has the best long-term outcomes.
That's excellent. And talking about outcomes, I'm sure you see this with couples who they've been trying to conceive. There's this sense of urgency that they often feel. So how do you set the healthy expectation of what the timeline looks like after a varicocele procedure? When can you try to conceive? What does that look like?
Yeah, so sperm is produced at roughly every 70 days. So every 2.5 months, you're getting sperm is being produced. Or excuse me, not being produced, but from the time of it being produced, ready to be ejaculated to conceive. So if you're getting a varicocele, generally I tell guys you're going to start to notice improvements in your sperm counts anywhere from 3 to 4 months. So it does take some time. So during that time, let your body recover, but really about 3 to 4 months is the general idea. And hence the reason why we were talking about this earlier. The earlier you get evaluated for potential varicocele or any type of infertility issues, the better, the earlier you address it, therefore you're not delaying much longer when it comes to trying to achieve your goals.
Yeah, that makes good sense. And it can kind of be complementary. I like to work with couples when they're trying to conceive. And if we're going to take couple months to wait for sperm production to be optimized, we can do so much work in that time to support the health of our egg cells as well. So I think that can be a beautiful system if we maximize the time that we have to take. I had a listener question come in, and I thought you'd be the best person to answer this. You did touch on this already, but this listener wrote in and said, is my partner's low testosterone related to his varicocele? And I'll even add to that, after you treat a varicocele, do we naturally see testosterone levels improving?
Yeah, it's a great question. So the most recent study on this showed that there's about a 90-point improvement in your testosterone production or your testosterone levels. Now is that for everybody? Obviously not, but we know that varicoceles impact testicular function across the board. Testosterone is not excluded from that. So by addressing the varicocele, we do improve hormone levels. However, the caveat to this is we have better ways of improving your testosterone levels rather than doing surgery. So if a guy comes in and he has no infertility issues, he has no testicular pain, everything is fine, but he has low testosterone and he has varicoceles, I wouldn't necessarily recommend a varicocelectomy for him because we have other less, like I said, minimally invasive or non-invasive ways of improving his testosterone levels while also preserving his fertility. So we don't need to do surgery to improve testosterone levels.
This is the perfect lead into what I want to talk about next. We got to talk about low T. That's so important for this conversation. So my first question is, I recently read in some literature that we're seeing more and more men between the ages of 18 and 45 who are really seeking testosterone replacement therapy. And that's the window where I see most men are looking to start their family, 18 to 45. That's like a pretty big window where we see reproductive goals. Is this something you're seeing in your practice too, younger and younger men coming in and wanting to go on some testosterone?
Yeah, well, for sure, and I think it's what's happening now is there's a lot of these clinics, these testosterone clinics that they're run by non-andrologists, non-urologists, run by if you want testosterone done right, you want it done by somebody again who knows what they're doing. So there's a lot of clinics out there who are just giving out testosterone to young guys, and what I see guys coming. So when you give testosterone, like synthetic testosterone, you're basically telling your testicles, don't do the two things that they do. Don't produce sperm, don't produce testosterone. So the reason why I see these guys is guys come to me, they're like, yeah, I've been on testosterone injections for the last 5 years and I have no sperm. What do I do? Well, it's like, well, listen, I mean, there's a reason why, because you're on testosterone. No one really tells them these things. So, to your point about why young guys are doing this, I think part of it's testosterone makes guys feel good, right? There's no question about it. I get the appeal, but you have to do this right, and you have to understand the risks associated with it. And unfortunately, at least where I practice, a lot of these like shopping center testosterone clinics, they don't tell guys about the risks associated with it. Everyone gets the same treatment, the same testosterone injections, and it creates problems for them down the road when they're trying to have families.
We just recently talked about this on the podcast, that when you give exogenous testosterone, there's this temporary contraceptive effect, and people aren't warned about this. And I find that to be really frustrating. I have couples and they've been trying for months, and the male partner's on testosterone and they had no idea that was impacting their outcomes.
Right. They're just not informed because these clinics, they make money doing it, but they're not doing a good job, at least from a patient care standpoint.
But it begs the question. I mean, the fact of the matter is sometimes these guys are prescribed testosterone because they truly have low testosterone. And if we take the testosterone away, then we have to deal with the low T. So how are you addressing the testosterone in a man who's really still desiring fertility?
Yeah, there's a number of ways where we could preserve fertility while improving testosterone levels. And that's the main question, right? When a guy comes in with low testosterone, I mean, I do a lot, like I'm an andrologist, right? I do a lot of low T from across the board, from guy who's in his 20s to somebody in their 80s. And the first question you have to ask all these guys is, are you interested in fertility? And if you are, when? Sometime in the next year, sometime in the next 5 years. And depending on where they are along that journey, or their in terms of fertility, that you have to custom tailor their treatments. We have a number of ways of improving testosterone levels effectively while also preserving fertility. So you don't have to be on testosterone injections and deal with the negative side effects down the road in order to improve your testosterone levels.
And it's just temporary, right? Let's say you have low T. you know you want to start a family, you probably would benefit from some testosterone therapy at some point. You have your children and live that part of your life, you can do testosterone later, right?
For sure, yeah. And
Yeah.
listen, I mean, if you're interested in doing testosterone earlier on, that's fine. But bank your sperm, for example, right?
Mm.
That's go to a sperm bank and bank your sperm. I would tell you, like, so they published a study probably within the last month, or maybe it was a few weeks ago actually, talking about guys who are on testosterone replacement therapy and their chances of recovery. There was a previous study probably published sometime in the last 10 years that looked at this, and all the guys had recovered, right? All the guys who were on testosterone replacement therapy, over time, over the course of 4 to 6 months, their sperm production recovered. A newer study was published on this where some guys didn't recover. And it begs the question, were they ever producing sperm in the first place? Tough to tell, right? Tough to tell. But to me, it's not worth the risk, right? If there's a chance that being on testosterone replacement therapy is going to kill your sperm production permanently, and I agree with you, to me, it's always been temporary, right? I can tell you anecdotally from my clinical experience, I've only seen guys recover. But based on some of these studies, you see some guys are unable to recover. So it's not worth the risk to me. Bank your sperm, right? Bank your sperm if you are going to jump on testosterone replacement therapy, and you'll always have the opportunity to use that banked sperm for fertility.
An interesting piece in some of these studies that come out showing recovery of spermatogenesis after discontinuing. It's like, well, sometimes it takes a couple years, and one of the factors is how low your testosterone was before you started therapy, and how poor your spermatogenesis was before you started therapy. But then we see these guys and they never had a semen analysis before they started testosterone. So we just don't have that knowledge to be able to give them informed consent about what might happen. And I think that is a bit of a disservice.
Yeah, it is. It is. Letting them know and informing about this is it's a great importance.
Right. Let's talk about lifestyle, because I've often wondered, like, we know all of these things like visceral adiposity or belly fat and being sedentary, that can all affect testosterone. But when we start to work on these lifestyle factors, I mean, is it enough? Do we see that lifestyle alone can get testosterone to a level that the guy is feeling good, or do you almost always need something more?
Yeah. It varies obviously, but I would say, so to your point, the current lifestyle that a lot of us are living, and this is to your earlier point of why younger guys are so interested in testosterone, it's because we live a very sedentary lifestyle indoors, so we're lacking that vitamin D. Sedentary lifestyle, so we're getting that adiposity, therefore more of our testosterone is being converted to estrogen. Our lifestyles these days are not conducive to normal testosterone levels, right? Or good, healthy testosterone levels for a lot of men. Not all men, but a lot of men. So can we reboot that system through lifestyle changes? Yes. Is it going to take time? Of course, right? And in this day and age where everything is right at our fingertips, we want things done now, today, that creates some problems, that creates some challenges on our end. So what I've found to do is, I've been quite successful with this, is I'll do something. So for example, one of the medications we talk about for boosting testosterone is called Clomid or clomiphene, which I'm sure you're familiar with. So we call this the Clomid challenge or the clomiphene challenge. So what happens is I'll put guys on this for anywhere from 3 to 6 months, and the testosterone levels will definitely rise. Inevitably, for young guys, right? This is primarily for young guys. Their testosterone levels will inevitably rise. And I always tell them, once you're at that point where your testosterone levels are in the 6, 7, 800 range, where those good, normal, healthy levels, that's when the lifestyle things are kicking in. So I'm giving you the energy in order for you to maintain. So start going to the gym, start getting better sleep, start exercising, start eating a good, healthy diet. All the things that are good for not just your hormonal health, your fertility health, your cardiac health, all of these things. And do those things, will come off the Clomid after about 3 to 6 months, and then you maintain, right? You maintain at that point, and you keep good, healthy testosterone levels once we kickstart your system with the medications.
Wow, I really like that approach, because we talk about exercise with patients. Well, sometimes they have fatigue that is so severe that they can't get there, or they have musculoskeletal pain that prevents them from exercising. So you treat those drivers so they're able to do the behavior change you're recommending. And then it's like this perpetuating feed forward cycle of good behavior change.
Exactly. We give them really it's just a kickstart. That's what it is. And then they feel good. They start looking at themselves in the mirror, like they look good. They build that self-confidence in themselves of whatever they're doing. It has this positive feedback loop, and they carry it on the rest of the way.
Okay, that's really approachable. I really like that. That was very functional medicine oriented, that approach, which that's my background. So I really appreciate that. I want to take a minute and talk to you about another theme that I see a lot in my patients, and that's they want to talk about vasectomy reversal. There's some percentage of men who get vasectomies, and then later on they have a new partner or they change their
Yeah.
mind and they need to get a reversal. So, will you talk to us about the effects on the sperm that we should be thinking about? Are there things that we should worry about?
Lifestyle wise?
The effects on the sperm, like does having the vasectomy for so long, now you're going to do the reversal. Do we see damage to the sperm? Is it poorer quality sperm following the reversal?
Yeah. So what we know is this. We know that so you're always producing sperm, even after the vasectomy, right? You're always producing sperm. And when we do the vasectomies, at least when I try to do them, I do them in a way of prolonging. I'll explain it like this. I do it in a way of leaving as much of the tail of the vas deferens attached to the testicle. Reason being is you're always producing sperm, and that sperm has to go somewhere. And the vas deferens, which we're cutting, it serves as somewhat of a pop-off valve. So as time goes on, as years and years go on, there's a buildup of pressure because they're still producing sperm, but there's a buildup of pressure in the testicle. And the more pressure that gets built up, the lower quality of sperm, the lower counts, all of the things that are important for fertility. So to get back to the question, generally we tell guys within 7 to 10 years after a vasectomy, your chances of a successful vasectomy reversal are close to 100%, right? 95 to 100%. After 10 years, 10, 15, 20 years, those rates decline significantly, as low as 60%. So the earlier you do the vasectomy reversal relative to the time of the vasectomy, the better off and the more successful you'll be.
So 5 years after your initial procedure is likely that it's going to be successful and you'll be able
Yeah,
to conceive.
as long as you've had kids before, you're still maintaining a relatively healthy lifestyle. Yeah, it's not a problem.
Mm-hmm. I read recently that the average time it takes for female partners to become pregnant after a reversal surgery is about 11 months. Is that true in your practice, or you see it happen sooner?
Yeah, I would say 11 months is a bit so similar to the varicocele. I generally say within 4 to 6 months, you're able to start having ejaculated sperm. Now, how much ejaculated sperm, tough to tell. It varies from person to person. But yeah, 4 to 6 months, and from there to the point of conceiving, that's a different, there's more variables involved there. But 4 to 6 months until you have sperm in the ejaculate.
Which that's a relatively short timeline. Like we talked about, it gives you the space to do all this other preconception counseling to optimize your chances. So I think, that would be a little comforting to me if I knew that I had this whole reversal that I needed to overcome. But then 4 to 6 months out, we could be having ejaculate with sperm. That's pretty exciting, actually.
Yeah, I agree.
What about anti-sperm antibodies? Is this something that we need to be worried about? And maybe this speaks to your point earlier of the longer it's been since the original procedure, we have more issues. Are these things related?
Not so much. You're just talking about anti-sperm antibodies
Anti-sperm antibodies, yeah.
relative to the vasectomy. Yeah,
After the reversal, do we see more antibodies?
no, not so much. That really isn't as much of an issue because we're not. You really see a lot of anti-sperm antibodies when you're going directly into the testicle, right?
Okay.
That's when you really see them more to the point where it's clinically has some kind of impact. But you're not really inducing a lot of your immune mediated, your immune cells just from the vas deferens. Um, it's really more so when you have testicular fractures or you're doing things relative to, down in the testicular area where you're opening up those tubules. That's when your body really sends that kind of response, but not from vasectomy reversal.
Okay, good. So if anybody had that on their mind and they were worried, they can remove that from their list of things that they're
Yeah, much lower
terrified
on the
about for this
list.
procedure.
Yeah.
Great. We've touched on this a little bit. I like I said, I'm typically asking my female patients to devote 4 to 6 months to really diving deep on their lifestyle factors, doing their labs, getting everything ready for preconception. And sometimes their male partner will do this with them. But let's say a guy has no known fertility issues. We just want to maximize his chances of conceiving with his partner. What's your advice on how long before they start trying? Should he start, doing the exercise and getting good quality sleep and getting dietary antioxidants to support the quality of his sperm?
You mean relative to what? Like how long before?
How long before the couple really starts trying to conceive, like timed intercourse, they're really ready to go?
Oh, I'd say at least 3 months. At least 3 months, yeah. And the point here is, it's like what you're doing, all these things that are good for your fertility health, they're good for your overall health. So these guys who are, we're telling these guys that, like, you're improving your hormone counts, you're improving your fertility health, but you're also doing your overall health, which is going to make you a more functional, better, more energetic father, right? So, you want to go into fatherhood with the best foot forward. So, these things, you're really killing three birds with a single stone. So, we're not asking you to do a lot of crazy things, but just improving your overall health is just good for fatherhood overall.
Yeah, I talk about that all the time with preconception counseling. It's not just preparing for pregnancy. It's also reducing our risk for cancer, cognitive decline, diabetes, all kinds of chronic diseases that prevent us from enjoying this family we've worked so hard for. So I think that point's very well taken. I always like to end our episodes with some fun questions. And so I have a few listener questions that I wanted to float your way. So the first one is the car seat warmer a significant enough source of testicular heat that we should say, no, you can't turn your seat heater on in the car?
Well, it depends on obviously how long the car ride is. There's a few variables involved, but I do want to give you a good answer. I would say if you're trying to conceive, you're better off not doing it. Yeah.
Mm-hmm.
Yeah.
That's great, because that's what I said too to this question. So I'm very glad that you agree. I mean, It's something we can control. It's a variable we can control. So let's just not do it.
Precisely. Anything that could potentially, even if it's a single digit percent chance that it can negatively impact your sperm health, don't do it.
Don't do it. Okay. The next question is, do you have an opinion on all of these direct-to-consumer or at-home semen analysis tests that we have available now? Like, I think it increases access because a lot of guys, in my experience, they don't want to go to the clinic and give their semen sample. Can we do an at-home kit?
Yeah, and I generally recommend it. I recommend it to a lot of my patients who come in from, they're driving hour and a half, 2 hours. Just do it at home. Do it at home. It's easy. These semen analyses, the at-home ones, they're pretty good in terms of matching them up with an in-office semen analysis. So they're good, and it like everything else with healthcare, telehealth, we're doing things at home. This is a great option now, and it will be even a better option down the road as the technology improves.
Mm-hmm. And so let's say someone does an at-home test, they find something abnormal. Then the next step is they reach out to someone like you who can help contain those results and help them figure out next steps, right?
Yeah, exactly. Yep.
Perfect. Dr. Houman, it's been such a pleasure to have you on the show and answer these questions that have been so prevalent in my feed. Will you let our listeners know where they can find you?
Yeah, well, thank you. It's been great too from my end. But yeah, you can find me anywhere online. Google the social media platforms. My name is Justin Houman, Houman. I'm on all the social media platforms, so feel free to reach out with any questions and let me know what I could do to help out in any way.
Thank you so very much for your time. I so appreciate having you. Big thanks to our show's producer, Paola Martini, and a thank you for our friends over at Needed who sponsored today's episode. Thanks so much, everyone. We'll see you next time. Did you love this episode and want to hear more? Head over to drkaleawattles.com/podcast, where you can find more episodes on all things fertility.